Your time right now, 8:19, bringing awareness to maternal mental health. Studies say 1 in 5 new moms experience a maternal mental health condition during pregnancy, childbirth, and even after. Joining us, we have Mallory Impari of March of Dimes. She's the director of maternal and infant health. Thank you for joining us.
Thank you so much for having me this morning.
All right, so let's start by, for those parents out there who they're new, what does a maternal mental health condition look like?
Sure. So I think the first thing I would share is really that it's a much broader range of symptoms and diagnoses than described by simply one term, whether that's postpartum depression or the baby blues, which are common terms that we hear. Perinatal mood and health anxiety disorders can really be experienced during pregnancy and up to a year after birth. So it's not even just during that initial pregnancy period. And then when diagnosed, they can include anything from major depressive disorders, bipolar depression, to generalized anxiety, just having fear for what life might mean for your baby. And so it's really important to be evaluated by a healthcare provider regularly, to be screened so that they can point you in the right direction for any resources that might support you.
Yeah, and I'm seeing 40% of Black women experience maternal mental health symptoms and nearly twice the rate of all women. And that's pretty striking. What are some ways to prevent this?
I think most important thing is to have a provider relationship. So one of the things that providers do is they are screening pregnant people throughout their prenatal process to ensure that no red flags are coming up. And if they do, they have processes to then refer them to services that can better support them. I think in addition to having that ongoing relationship with a provider, it's really important for moms, if they're able, to build a supportive network, whether that's with their friends, with their family, with other people who have been pregnant, because just having that social support has been really predictive of better outcomes.
And then there is this new drug out that is supposed to treat postpartum depression. What do you think about that?
I think that we know that even when we have new advancements, there are core activities, engagements we can be doing that already have a proven track record of success. So again, those things like supportive groups, I'm hopeful for, predicting people being at risk for postpartum depression and other mood anxiety disorders, but I'm more comfortable relying on what we know what works best, which is having an engaged relationship with your provider and, of course, finding mental support services where necessary.
Absolutely. And how could we join the movement? How could we help?
I think one of the best things to do is really to continue provide awareness. We've been talking a lot about maternal mortality, especially among Black women, as a huge issue in this country. But one of the contributing factors to that is maternal mental health disorders. And so it's important that we understand that there are other issues that contribute to these larger outcomes that we see. So just continuing to talk about it and make women aware that this may happen to them so they can reach out at the appropriate time is critically important.
All right, Mallory Impari there. Thank you for joining us on DC News Now.
Thank you so much.